Hi, this is Xanthi. I'd like to talk a little bit about a topic that's been going around in my head. I'm reading a lot of articles about it. It's a very controversial topic. It's what's known as, it's a word called neurodiversity, and there's a movement to do with neurodiversity, which is saying that people have different types of brains and that those brains should be valued. Now, you know, that all on the surface sounds fine to me, but when I look at it a bit closer, I just notice it's almost like a cult. Like, I first heard of the word over 10 years ago. I was told by a psychologist and a psychiatrist that I was on the autistic spectrum, but they didn't give me a diagnosis in writing because they told me stigma and because I'm an adult, so it doesn't really matter. So that was the attitude, and that was in Australia. So I was seen by other psychiatrists and who said, oh, we don't see any signs of autism. I feel like I fit nearly every characteristic to do with autism. Females, lists I've seen, I stim a lot of the time, I have trouble with eye contact, I piss people off without trying, and sensory issues, lots of things that seem to fit. But I have since been assessed formally, and again they told me it's not really an adult thing, this is in New Zealand, it's a childhood disorder, blah blah blah, and it's actually better if we don't give you that diagnosis because then you might get denied treatment for PTSD. So I was diagnosed with PTSD and bipolar. So it's a little bit sort of off the side, a little bit of background there. But anyway, looking back at the neurodiversity, I used to think, oh, that was a good idea. Now I've noticed it's actually become kind of what extremist, like some people, and I've noticed also they're including bipolar and schizophrenia in it now, and saying that some of the central things that get said is that they don't want to cure the neurodiversity. So the neurodiversity defined as being people with different brains to the norm. So the norm are called neurotypicals. So they're starting to include mental health conditions such as bipolar, and I've been diagnosed. I've been seen by 5 psychiatrists who say I have bipolar 1 and a couple of psychologists. So I didn't want the diagnosis at first. I said, no, I'm autistic, I don't have bipolar. So it took me a long time to accept the diagnosis. Anyway, coming back to the neurodiversity, I noticed that it's very much an identity thing. Most people on the autistic spectrum, from a poll apparently, like to say that they are autistic, not that they have autism or a person with autism. Yet some people do prefer that. So I notice that some people that prefer that language will get told that they hate themselves, and it's just ridiculous. There was I read an article and saw a video by a man who said that he would rather be cured of autism, and he just got shot down really bad, told he hated himself. I do feel like the neurodiversity movement seems to be by people with, they try to say that there's no such thing as severe autism. I feel like it's dismissing the people that do. I find it very disabling. I mean, there seem to be the people that can be very articulate, having the biggest and loudest voices, and I think I think it's great to be able to have a voice, but when people are attacking other people within the same diagnosis, yeah, I think there's a problem with it. I mean, look at bipolar, for example. I'm in a bipolar support group, and the personalities are really diverse. We've got people that are Christians, people that are atheists, people that are different political views, people different personality types. Some people believe in a certain diet, others don't, and you know, very diverse. And you know, I don't speak for all people with bipolar. I mean, personally, I don't see bipolar as my identity. I don't hate myself. I see it as something that I no longer reject out of shame. So I guess you could say it's partly my identity, but I don't see it's fully my identity. People, the neurodiversity movement like to say that oh, you know, there shouldn't be any cure. Yeah, there is no cure for bipolar, but it can be managed. It's a bit like diabetes. You know, you can use medication to help manage it. My identity or beliefs actually shift around depending on mood states that I'm in. So the mood episodes can be quite significant, can be very disabling. You're seeing at the moment probably more my social anxiety, what you can see now, very mildly, but at times it's severe. My bipolar is managed by meds, but I have specifically asked not to be over medicated because I do not want to be drugged out like a zombie. So it's taken like many years for mental health profession to start listening to me rather than doing what looks best from the outside. Yeah, so I do see correlations here with autism, so I do have empathy, but I just think the fanaticism, the attacks, the toxicity, I just think that's, yeah, it makes me not want to use that neurodiversity word anymore. I don't, I mean, I notice that in other groups, yeah, it can be quite black and white to do with sexuality. For example, there's all these examples, arguments about whether you are this and whether you are that and whether you're allowed to identify as this or that. It's just complete bullshit. So I kind of get a bit sick of it. I am all for increasing acceptance and understanding and reducing stigma. I'm all for that, but I'm afraid I don't like it when I see things like someone wrote on social media, there is no bipolar, there is no autism, there is only neurodiversity. And you know, it's just I notice another trend is that people are encouraging self-diagnosis. I personally don't think that's a good idea because even the experts have trouble getting things right. I mean, I've been misdiagnosed so many times. I guess out of frustration was one of the reasons why I rejected my bipolar diagnosis at first. So yeah, I don't know if I've expressed myself very well here, but it's just been going through my head. I did read a lot of the to and fro. Seems to be neurodiversity. Some of them are saying yes, they're fine with treatment. Others are saying no, they don't want anything to do with the medical model. Yeah, there are heaps of problems with the medical model. A lot of people don't want to be called disorder. Well, disorder is just something that is causing impairment and distress. That's what the definition of disorder is, but people get so offended about it. Yeah, so I have 3 diagnosed disorders. So social anxiety disorder, post-traumatic stress disorder, bipolar disorder. Yeah, and sometimes I can be extremely disordered. It's, yeah, just, I feel that people going very extreme anti-psychiatry, yeah, psychiatry does have problems and all of that, psychology has problems, but going to the extreme anti, I mean, there are groups out there known as anti-psychiatry, I think it's going to help no one. It's going to be a bit like, back in the days, I still get told sometimes that I'm demon possessed. That's not helpful either. So yeah, I am very wary of extremism. I do see it in the neurodiversity movement. I am very wary that they are trying to say that bipolar and schizophrenia are just other ways of being. Yeah, I could say that there are certain parts, like in hypomania, yeah, I can be really productive, face my fears, do things I wouldn't normally do, I've achieved things, blah, 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 but then I crash and fall off the cliff. And the rate of suicide with bipolar is 15%. It's about 20 times more than the general population. And then you've also got the risk of people being in a mania state, which I've been in as well, doing things like thinking they can fly and jumping off the buildings. So it's not safe. It's very disabling to be in extreme mood episodes. So mania is the full elevated state, hypomania is partially. I've been in both, and then you get different degrees of depression as well. So just trying to say, oh, look at people like Van Gogh, who some people speculate has bipolar. I mean, Van Gogh killed himself. I mean, So, yeah, my view is, yeah, all for learning to accept people with disabilities, include mental illness. Some people are trying to say, oh, there's no such thing as mental illness. And then there's other people that are going and blaming everything on mental illness whenever someone shoots someone or something like that. So yeah, there's a lot of stigma, but I don't think forming, having them and us groups such as neurodiversity actually, I don't know, just kind of really off-putting to me. I'm just feeling very wary about pulling in very serious mental health conditions such as bipolar and schizophrenia into it. For a lot of people on the autistic spectrum, yeah, it can be like a personality quirk, you know, but for others, it affects them so severely that they bang their heads on walls all day, cannot use the toilet, cannot communicate with anyone, but we get told there's no such thing as severe, and these are by people. It's a bit like, to me, someone with short-sightedness like I have, trying to speak for people who are blind. It's a completely different kettle of fish. So yeah, I have concerns. I don't like the extremism I'm seeing within the movement, and I have concerns that it's going to actually, because the autism, some of these activists are trying to get the autism taken out of the DSM, which is the Diagnostic Statistical Manual, which psychologists and psychiatrists use. Well, they're going to do that with the bipolar as well, the schizophrenia. So yeah, I don't think it's a good idea. Sorry if I haven't been very smoothly articulate. I do have difficulty expressing myself verbally. but I decided to do it anyway, just so that you can see that I am a bit different, but I am kind of hopefully not that scary. I'm a person with mental health issues, and yeah, I do ask for tolerance, and it's not just the autism crowd, I see it in other groups as well. There's a lot of fighting, there's a lot of policing who is allowed, who is not allowed. I guess if anything, bipolar has helped me see things from different perspectives, but I don't like the fighting over things, and I mean, I asked people in the bipolar group if they saw bipolar as their identity. Some people said yes, some people said no, some people were like me in that it was partly in the sense that it's what they've known all their lives, but with medication and support we may have less extremes and less frequency of episodes, so we do know what it's like to be reasonably more stable and able to function a bit better in society. So if you took away my bipolar disorder, would I still be me? I'd like to think that I'm still creative. My patternicity that I have has been, where I see patterns and links and everything, has been attributed to bipolar, but then when I'm medicated I can still do it. I can still see all the patterns. I just see it to the extreme when my mind is racing when I'm manic. Creativity is linked to bipolar, but a lot of people with bipolar are actually homeless or on the brink of homelessness, and can't work full-time. I can't work full-time. If I wasn't in the place I'm in now, I'd be homeless. So yeah, we are vulnerable, definitely, and but I don't think blaming it all on society, making a them and us, is actually going to help things. So anyway, I just wanted to try and talk about the topic a little bit, and I'll probably touch on some of the other aspects a bit more detail another time. Thank you.